Alrighty. Okay, I'm going to make a start. So I will start sharing.
Okay, I can hear you now.
Okay, awesome. So let's share this one. And jump on presenter mode. All right, can you see my main screen now?
No, I can only see myself.
Oh, just double check I'm sharing. Could you see that, Shelley?
No, not yet.
No.
Something's
Okay.
happening
Okay,
now.
here you go. Yeah,
We're good.
But we can see your yep, perfect.
Yep, cool. Okay, nice one, thanks.
Okay.
Alrighty. So let's get some of these toolbars out of the way. Rightio. So thanks for coming along. So today's the info session on dosage. Before we get going, I'd just like to acknowledge the traditional custodians of the land on which we gather today. So I'm coming to you from Canberra, so that's the Ngunnawal and Ngambri people. We pay our respect to elders past, present and emerging, and extend our respect to all Aboriginal and Torres Strait Islander people. We acknowledge the First Peoples as the first scientists, educators and healers. So today's an information session. It's a pretty informal process. It's a pretty informal process. I'll just ask everyone to mute if you could. That'd be great. Today's just an opportunity to come along, have a discussion around some of the content that we're proposing. There's no formal decision making, and there's a facilitator on hand, which is myself, who is familiar with the resource, but we also have a number of fire experts on the line as well. Today, I'm going to be talking about dosage, so giving a bit of an overview on dosage and then a deep dive into dosage. I'm going to be looking at the dosage use in other implementation guides, and finally, a sneak peek at the proposal, which we will have a vote on next week, but it gives you a bit of chance to review that proposal. So first up, I just want to go to Menti. So if everyone could grab their phone and scan the code or go to menti.com and use the code 77255881. I'll leave that up for another 30 seconds or so. We're going to do a couple of mentees just around figuring out who we've got on the call and also how familiar people are with various parts of fire. Okay, I'll move on. Whoops, sorry. Shelley, do you want to share now?
Hopefully everyone can see my screen okay.
We can only see your video, actually.
Oh, that's not helpful. One moment.
Yeah, we can see your screen. Like I'm seeing the Menti.
Oh, fabulous.
Can you see the actual Menti or just the Menti QR code?
No, the actual Menti, like the balls are moving in the screen.
Ah, okay. Can you see it on the Zoom though? I can't see it on the Zoom.
Yeah, we can see it.
Yep.
Okay.
I'm on the Zoom mobile app and it's coming through at least.
Interesting. Okay, I can't see it. I'll just have to trust you. Do you want to just run it, Shelley?
Yeah, no troubles. Yep.
Off to a great start. So I will just bring up the Menti as well, and I'll just have a look what the questions are. All right. Yeah, so the first question, what is your role or background? So if you could indicate on there, that'd be great, just so we know what people we have in the room. I can't see the actual responses, Shelley. So
Yeah, we've got about 15 responses.
okay, that's pretty good. We've
We've got
got
26 on the
26
line.
on the line, yeah. There's a couple of AIs on the line.
Haven't been going up for a little bit. I've still only got 16, so
Guys, can you give me the URL? I accidentally closed it.
yep. So if you just go to menti.com,
Menti.com.
yep, and you can use code 7725 5881.
So 7725 5881.
That's correct.
Yep. Okay, great. So I've got the Menti up now. So we've got a number of people from product management, software developers, architects, a couple of health informaticians. That's great. Let's go on to the next one.
Just putting the code in the chat there in case anyone needs it. Yep, there we go.
Yeah, thanks. Cool. So this next question is, how well do you know AE Core? So we've just published AE Core R1. We're developing R2 at the moment, and so we're just interested on knowing how well, how familiar you are with AE Core. Great. Got a few fire starters. Number of fire starters. That's great. And a bunch of people catching fire. That's awesome. Excellent. We'll end that poll in a few seconds. Okay, great. So it's a really good mix of people in the room. I think we've got lots of fresh faces, but also some people that know AE Core pretty well. So next question is, how well do you know the fire dosage data type? So if it dose not compute, or if you're learning, so that's titrating your knowledge. If you're pretty good at it, you're within therapeutic range, or if you are an expert, you could be overdosed. Does not compute. That's good because that's what we're going to learn about today. Titrating my knowledge, cool. Cool, so we're about to split, which is split between new people and people that are learning. That's awesome. A couple of people that know about the dosage data type, which is great. Next question, we'll end that poll now. Well, the next question is, what use cases involving dosage information are important for you? So if you've implemented dosage, or if you have a system that's using dosage, what are the use cases for that? So that could be prescribing or dispensing, could be administering medications, pharmacy dispense, yeah. Current meds, lots of prescribing. Communication, cool. Administering, that's awesome. We're going to be talking about administration today as well, just briefly. Dose calculation, yeah. It's a big part of the dosage data type. It's about recording doses and calculating doses, actually. Prescribed medication list, cool. Okay, let's move on to the next one. So for those use cases, is dosage implemented in the context of which fire resource? So I think it's multiple choice answer, medication statement, request, dispense, or administration, which will be an interesting one. As I mentioned, we'll be talking about administration briefly. Medication request, yeah. So that'd be the prescribing case, medication statement, current meds. reconciliation, dispensing systems getting up as well. So the question in the chat, immunization. So immunization doesn't have dosage on it. Someone correct me if I'm wrong. But immunization is essentially a specialty of an administration. Okay, cool. So mostly statements and requests, some dispensing and some administration. Okay, that's great. All right, so we'll go back to slides and I will take over again.
Yep.
Thanks, Shelley. And go back to this screen and start sharing again. Okay, cool. So dosage overview. Should be able to see that screen now. Yep. Okie dokie. So dosage overview. So this statement here, the dosage structure defines general dosage instruction information typically represented in medication requests, dispensers, and statements. That comes straight out of the fire spec. You might be wondering why administration is not on that list. And we're going to talk about that in a moment. The dosage data type is one of the most detailed data types in FHIR. It is very flexible. It can represent free text dose instructions. So an example there would be add 1/2 to 2 capfuls to bath water or apply to wet skin and rinse. So it can also represent structured data. It's a very detailed data type. So it has a lot of fields for capturing really rich structured data and dose syntax. And one of the interesting things around dosages is that you can have a number of different types of doses. So you can have concurrent doses, you can have sequential doses, and those sequential doses could be either titrating up or tapering down in terms of the strength or the amount that is being delivered over each dose. So an example of a concurrent dose would be take 1 tablet daily in the morning for a week, but also take 1 tablet daily in the evening for a week. So that would be represented as a concurrent dose because it's of the same thing and it's on the same day for the same duration, same amount, but it's happening concurrently. And then we have a sequential dose. So this one is tapering down. So we have take 30 milligrams once a day for 4 days, then 20 milligrams once a day for 1 day, then 10 milligrams once a day for 1 day, and then stop. Now, all of those dosage types there in the concurrent and sequential section, they're text that I've written there, but they can be represented fully structured. And so we're going to get into that in just a moment. You can also have patient-oriented instructions, so information that is specific to the patient in sort of a patient-friendly bit of information. Okie dokie. So I mentioned administration. So medication statement, request, and dispense, they all use the dosage data type, which is on the right there in that yellow box. We're going to dive into that in a bit more detail in just a minute. Medication administration doesn't use the dosage data type. It uses what we call a backbone element. And that's just essentially like a complex type, which includes multiple bits of information. So the backbone element for dosage has been modeled on the dosage data type. And so it includes many of the same fields, and they're all of the same type, so string or codable concept or whatever it might be, quantity, so that they are roughly the same, but it specifically excludes certain pieces of information. The dosage data type itself is intended for prescribing. So medication administration doesn't use that because it's not about prescribing. It's about recording the actual administration, not just the intended dosage. So instead of a decision was purposely made on administration that instead of carrying some unused fields from dosage into medication administration, it was designed only with the elements relevant to actually administering medications. Any questions on that one? Now, again, I can't see the Zoom, so if you do have questions, just speak up or raise your hand. No, okay. Alrighty. So now a bit of a deep dive. So this is the dosage data type. As I mentioned before, it's pretty complicated. Lots of different fields in here. It also includes timing, and I would argue that timing is probably the most complicated fire data type in fire. So you've got an already complicated one with also timing inside it. So it does become very rich. This screenshot here is actually from AU base. So you'll notice that a couple of the bindings are for the Australian context, but it does have all the original fields in there from the Fire R4 standard. I'm about to run through each of these fields in order. So if anyone wants a specific one, just let me know. Or Shelley, if you could just monitor the questions or the hands up, that'd be great. And just stop me as you need to. Okay, so sequence. So the dosage sequence, this indicates the order in which the dosage instructions to be applied or interpreted. Essentially, you can have multiple dosages for a particular medication. So a medication request or a statement or a dispense, you can have multiple dosages. So I mentioned before that they could be singular, sequential, or concurrent. You would use a multi-sequence dosage where the dosage instruction changes, or where there's a concurrent dose, or where there's optional follow-up doses. Not all doses need to be actually administered, and they may be at different dose strengths. So a singular dose instruction would be something similar, or something simple like take 1 tablet once daily. A sequential or a titrating dose, as we said before, take a certain amount for 7 days, then a lesser amount for 3 days, and gradually going down or up. And then concurrent dosages, as I mentioned before, you'd be taking 1 in the morning and 1 at night. They're the same thing. It's the same strength, but you're taking them on the same day. Okay, I'll move on. As I said, just speak up if there's questions or raise your hand. Okay, dosage text. So this is free text, and this is generally used when the instructions might be too complex to code, or it would be used when you have fairly complicated dosage syntax and you want to represent that in a text-based form. Anything additional about the administration or about preparing the medication, that should be included as text. Importantly, it doesn't include the name of the medication. That's a recommendation because the actual medication statement or the medication request or dispense, that carries the name already. And if you do have coded instructions, it is recommended that the text represents a complete representation of those coded instructions. So yeah, free text. There's another field called additional instructions. So this one is a codable concept. So a codable concept allows you to carry either coded information, so a code system, code and display, or free text. So it allows you to have either. You can have multiple additional instructions. So on the right there, I've got an example of multiple additional instructions. So we've got there one that's coded, dissolved under the tongue, and the applicable code for that, and then some additional instructions. Please do not chew the tablet. So that one's in text. There is a bit of an overlap in additional instruction with another field in dosage called timing when. It's a timing when code. And there is a bit of guidance around if you have that particular case, you would use timing when instead of an additional instruction, but there's no hard and fast rule around that. things like continue or discontinue codes, they could potentially be in additional instructions also. So alongside additional instruction, alongside the text actually. So the text is designed for a clinician. The patient instructions are designed for the patient. They're oriented more towards the patient. Sometimes they may actually be the same, but there could be some language that you might want to change. Generally, if there is both text and patient instructions, generally, if there are no patient instructions, then you would use the text for the patient instructions if you needed to represent those out. But a couple of examples here. So for a clinician, you might say that you want to prescribe 30 milligrams daily for 5 days. But the patient might see that as take 6 tablets daily for 5 days. So slightly different wording oriented for the patient or the consumer of the actual medication that's being prescribed or dispensed. Then we've got a couple of flags around essentially the PRN status. So you can indicate if the dosage is to be taken as needed, and you can indicate that in 2 ways. One with just a simple true false, or one as a coded element. So you could use the a coding for saying take as needed for nausea, for example. So that's what that example on the right is. It would be indicated as needed because of nausea. So 2 different ways to represent the as needed status. Now, timing. I mentioned timing is pretty complicated. There's a picture of it on the right-hand side there. I wasn't going to necessarily go into timing per se. I can talk through each of those elements. What I might do is just stop sharing at this point and just go back to the Zoom and oops. And just see if we have any questions on the line. We've got a couple of items in the chat. Okay, does anyone want to ask any questions in particular at this point in time before I go in? And also, would people like to see information about timing before I move on to other items? Maybe thumbs up if you want to see timing. You can just talk through each of the elements.
Maybe if there's time at the end to come back.
Okay, yeah, I'll come back to timing. That's a good point. Okie dokie. I will keep going then. Okay, so timing is essentially around when the medication should be administered. You can have lots of different expressions. You can say that it's take it every 8 hours, take it 3 times a day. You can, on certain days of the week, on certain dates, you can have time offsets. So you could say, make sure you take this half an hour before breakfast, on certain days of the week. Interestingly here, there is a mapping between AU-CDI medication use statement dose timing and AU core medication statement timing. So in some of that, so in the medication statement, sorry, I'll just get you guys to mute if you could.
Yeah, that's fine.
Shelley, would you be able to mute people if you could? Thanks. So yeah, there's a mapping.
It's my
Sorry, Brett, I think it's you that keeps coming off mute.
Okay.
I keep muting Brett, but he keeps coming off.
All right. Okay.
Sorry
no
about
worries.
that.
That's all right. I'll just push on. So yeah, as I was saying, there's a mapping between AU-CDI medication use statement, dose timing, and medication statement timing. So that may factor into any proposal that we come up with. I will just skip past timing, as I mentioned, because it is complicated, and we'll come back to it if there's interest at the end. Sorry, when I mean the particular items in the list. Here's a couple of examples. So maybe we'll choose this antibiotic course. So we could say a repeat frequency of 3 means take it 3 times, and then 1 day for 7 days. So joining that all together, we can express this particular medication as take 3 times daily for 7 days. And then this insulin one in the bottom, this has a repeat frequency of 2, so that would be take it 2 times. It's got a period of 1 day, so take it 2 times in a day, and then it's describing when you want to take it. So we've got a code of ACM, which means before breakfast, and ACD, which means before dinner. So we're saying take it 2 times, 2 times a day, before breakfast and dinner. Sorry, before breakfast and before dinner, and then an offset, so 30 minutes before the meal. So that all translates down to inject 10 unit. Well, the 10 would actually be in the dose quantity, so you could skip that, but it would be essentially take the medication 30 minutes before breakfast and dinner each day. So you can see that you can represent that in a coded form. So even if it's fairly complicated, like this particular instruction, that can be represented in a dosage dose syntax. Another one, the day of the week. So we've got Monday, Wednesday, Friday. So take whatever it is on Monday, Wednesdays, and Fridays would be how that particular one is represented. Okie dokie, moving on. So site route method. So these are grouped together because they're fairly similar. They go together, and they're all the same data type. So they're all coded as codable concepts. Again, that can mean it can be a code, or it could be free text. So site is where the medication is administered. So a couple of examples there. The route is how it's administered. So it could be injected, or it could be a topical route of administration. And the method is the technique that you do. So that's where you say you could inject that particular medication, you could inhale it, or it could be take orally, for example. So those are those 3 types. And this also has a mapping in AUCDI, the medication use statement route of administration. That maps to AU core medication statement, the dosage route. Okay, now moving on to dose and rate. So this is where it describes the amount of the medication that actually needs to be taken. So there is a type, and there's a couple of different types in that value set there, that dose and rate type. And the 2 types in that set at the moment are ordered or calculated. So a medication could be ordered if it's specifically ordered by the prescriber. So they've specifically said take 2 tablets, or the type could be calculated. And that could mean that the dosage is determined based on specific patient factors, or maybe some sort of test. So it could be based on weight or age, or maybe blood glucose levels, renal function, liver function, things like that. So some sort of test could be describing how much the medication needs to be taken, and that's based on a calculated factor. So that's where the type comes in. And then you'll see the next element here is that dose and also rate. It's actually a choice. And so we're going to dive into those now. So the first choice that we have for dose is dose range. And this is the amount of medication given in one event. So it could be a range between high and low. So it could be 1 to 2 tablets. So take 1 to 2 tablets, or take 7.5 to 30 milligrams, for example. And that's described again in a high and low fashion. So that would be how the range is represented. And then we've got a single quantity. So again, the dose is amount of medication given in one event, this time represented as a quantity. This one's just a simple value. So for example, 1 capsule could be taken for the dose quantity. The next type of way you can describe a dosage is around having a rate, and this is around an amount of medication given over a unit of time. So this has the first option is a ratio, rate ratio, and this allows you to specify a numerator and a denominator. So you could say the medication needs to be administered at 30 mils per hour. And so there's options there for you to describe that particular ratio. There's an example there on the right of 30 mil per hour. The next one is a range. So again, a range has a high and low value, and this rate is still over the unit of time. And so you can say, for example, 1 to 2 liters per minute. So in the last one, we had a specific amount per time. Now we have a range of an amount per time. And then the third option that we've got here is actually a quantity. So rate, quantity. Oops, I got the wrong text on that one. But it is a specific value. I'll correct these slides here. It is a specific value, but it allows you to specify a specific unit that may not exist for your ratio. So in general, if you're going to be using a code that represents some sort of measure over time, you would probably use rate ratio. But there is an option here to specify just a specific amount. So yeah, that's an interesting use of rate there. And the last 3 fields that we've got are around max dose. So the maximum dose, there's 3 different types you've got here. So you've got a maximum dose per period of time. And this specifies the upper limit for a period of time, the upper limit on the medication for a period of time. So for example, 2 tablets every 4 hours up to a maximum of 8 in a single day. Yep, specifying the specific amount per day. There could also be a maximum dose for an administration. So that could be based on body weight. And so, for example, it could just be a simple 2.5 milligrams. That's the maximum dose, your amount that you should be administering for any single administration. Now, these are not a choice, because you could actually say the maximum amount per administration and then a maximum dose per day also. So that's why they're allowed there as 3 individual fields rather than a choice. And the last one there is max dose per lifetime. So this could be based on body surface area. So for example, 600 milligrams per meter squared. And so I looked up an example of that. That could be like a chemo drug, which may have a maximum cumulative dose over a patient's lifetime. Yeah, that's an interesting one there for max dose. Any questions on the fields? See if I can find the Zoom.
Nothing
Can't
in
see
the
the
chat,
Zoom.
Steve.
Nothing in the chats. Okay, no worries. We'll keep moving on. So dosage and other IGs. So this is what's going to inform our profiling. So in IPS, IPA and US core, which is what we're aiming to be compliant with, medication statement has only a couple of must support elements. So in IPS, it's only text and timing. US core doesn't actually have a medication statement profile. And in IPA, International Patient Access, it is only text. For medication request, text and timing, again, for IPS, In US core medication requests, you've got text timing and dose quantity. And then in IPA, again, only text. And we have then, based on all that, and I know that I just went through every single field in Dosage, but based on the IPA and the IPS and the US core, the initial proposal that we're bringing forward for AU core is to only add must support to text. This would align us with IPS and IPA, and not preclude you from using any other field that you like. But adding in text means that we would have the maximum amount of support across those other IGs. Noting that AU core is essentially the minimum shared across all the different use cases. It's not necessarily, well, it's not specific to any particular use case, even things like patient summary. It's very agnostic to all those different use cases. So AU core would be the foundational base for dosage, and then patient summary and other usages of the medication data types would potentially add on additional fields. The other thing to note here is that we are not proposing at this stage, and I'm welcome to take this feedback. We're not proposing to have a dosage profile per se. So this will be in line on medication statement and medication request. If you would like to talk about that, I can talk about that. Just let me know. So I guess the next part is in terms of informing our profile design. So that initial proposal is up, and all the feedback is able to be submitted. We do have a Zulip poll on the implementation of Dosage. So if you're using Dosage in your system, where we've got a couple of questions. So firstly, if you implement it, second, in the context of which FHIR resources, and third, going through that big list of all the different fields that are in Dosage, which ones do you support? So that's up on Zulip. And I guess the next steps are that I do have a proposal up. So I'll bring that up in just a moment. The proposal for review for medication request and for within medication statement. So that's in a branch. It's on GitHub in the AU core repository. We have a page on the HL7 Confluence for AU core R2 dosage, where you can submit any feedback. Interestingly, we need to have this, well, sorry, importantly, we need to have this information in by the 17th of March, which is Monday next week. Because on Tuesday, in the next AU core TDG call, we're going to be voting on it. Now, this TDG call is actually going to be on Teams. It's normally on Zoom, but it's going to be on Teams because we are going to be in Sydney at the HL7 symposium and Connectathon couple of days. So this one's going to be on Teams. The information is on the Confluence page on the 18th of March 2025 TDG agenda minutes page on Confluence. And so the idea is that then after this, we will take that proposal, assuming it's voted on. That proposal will then be included in a draft of AU core R2 and also flow across to patient summary R1. And that will then be announced on the AU core Zulip chat.fire.org channel. So any questions or discussion on that? I'm just going to stop sharing. And yeah, has anyone got any questions? Would you like me to go into timing? Still got a bit of time.
Steve, given there's some time left, let's talk more about the timing then.
Sure, no problems. Let's go into timing. I'll just bring that up. Okey-dokey. Okay, timing. So this one's pretty complicated. So you can have two different types of events within timing. You can have a single event, so that is that the event happens on a specific time. So that would be essentially a one-off administration. So, for example, take today at 3 p.m. That would be a specific date when that thing has to happen. You can have multiple times, but it would essentially be do it at this specific time of the day. You can then have repeating doses. So this is where the repeat element comes in. So essentially this entire block in repeat all goes together. So if you have multiple times that this thing needs to be taken, then you would have multiple repeat blocks. So it has a frequency. So that is how many times per period the dose should be taken. So for example, take 3 times a day. It's got a period and unit. So that is the day or the hour. So take every 8 hours. You would indicate within the frequency and the period. So frequency of 8, period. Sorry, the period and the period unit would be the 8 and the hour. So take every 8 hours. And then has, if we look in the middle here, we've got the bounds, duration, range, and period. And this is defining the start and end limits. So for example, a duration could be for 5 days, a range could be from 1 to 2 weeks, or a period would be specific dates. So from the 1st of January to the 31st of January, for example. So depending on how you want to prescribe those particular meds. The count is the number of times that this particular item is going to actually repeat. And then the count max is the maximum number of times. So if we needed to describe, say, take between 5 and 10 doses, you might say 5 and 10 for the count max. Back onto the frequency, we've also got a maximum frequency. So this is the maximum frequency allowed within the particular period. So take up to 4 times per day could be what we just define as the frequency. What else have we got? So the day of the week, these ones are interesting. So this is when you can say take on Monday, Wednesday, and Friday, for example. The time of day is what time of day you should be taking that on those particular days. So take at 8 a.m. and 6 p.m. The when codes are things like upon waking or at bedtime. So HS is bedtime. So that would be when you would describe if you needed to take the medication at bedtime. I mentioned the offsets in the example earlier. So this is 30 minutes before breakfast. That's how you describe an offset. And then the last item here is code. So this is when you want to describe using the timing shorthand. So for example, BID for twice daily, QID for 4 times daily, AM or PM for morning or evening, morning or afternoon. So if you wanted to describe the dosage in shorthand, you could say take BID. That would be then ideally accompanied with a patient instruction that says take twice daily.
Sorry, Steve, I've got one question from Neil from MIDI Records.
Yep.
So timing which repeats on two different period units, say day and week, would be represented by having two repeat segments, like take 2 times a day every 3 times a week.
Yes, unless they could be, so sorry, say the example again.
Neil, are you happy for me to repeat, or did you want to come off mute and talk to this yourself?
You have a better voice, please.
Okay. So the question again was, so timing which repeats on two different period units, so say day and week, would be represented by having two repeat segments. So for example, take 2 times a day every 3 times a week.
Take 2 times a day, 3 times a week.
Mm.
You could do scribe in 1, I believe. 2 times a day, you would have frequency of 2 period of day, and then 3 times per week. Depends if it was specific days. You could, yeah, you would probably split it into multiple repeats, yeah, to make it 3 times, yeah, if you've got it like that. Yeah, I don't know if we've got an event timing for those particular ones.
That's a bit weird.
3 times a week. Let me just go to the examples. This might help you.
There's actually two periods going on there. That's the problem with that one.
Yeah, yeah.
So I'm not sure that it would even be a repeat segment unless you're breaking it down into the 3 repeat segments, if that's what you meant, Neil.
So there's an example here of the antibiotic course, which is 3 times a day for 7 days, which could be similar.
Well, it's the period is 1 day.
But it's the period is 1 day. That's the problem. Yeah, yeah. That would be an interesting one to model, actually. Yeah.
That's where we get stuck on, actually.
Oh, really?
When to text.
Yeah.
So one other question: if there were more than one repeat segment, do we consider those as being ANDed, not ORed? So
They're ANDed, yeah. So that would be where you, in fact, I think with your particular example, if you were to specify the days of the week, that would solve your problem, because then you'd have one period and then on specific days.
I was going to say that's how you usually see it. It would be take 2 times a day on Monday, Wednesday, and Friday.
Yeah. Yep.
okay, thanks.
Yep. Any other questions?
Sorry, it's Steph here. Sorry, I'm on my phone, so it's a bit difficult to follow on the chat. But for that example that Neil mentioned, wouldn't we just have 2 dose and rate? Because that dose and rate element is 0 to many. So
Dose and rate. The problem is the period. So if you're taking it once a day, if you're specifically specifying it's per day, yeah.
So dose and rate is for each of those times it's taken.
Yeah.
So what we're struggling with here is the timing, because there's 2 periods. So as Shelley suggested, having 3 repeats
On different days.
To get the 2 periods. Yeah.
Okay. Thanks.
Yeah. Any other questions on that? Okay, I'll bring up this slide again. So as I mentioned, there is a proposal for review. I should probably open that.
I've put the links in the chat too.
Oh, you've put the links in the chat? Okay, awesome. Great, yeah. So links are in the chat for those two. And then have you put the link in for the draft discussion Confluence page, Shell?
Yep.
Yep, awesome. Great.
And Heath's got his hand up.
Okay, cool.
Can you just go back to what you said the IPS has in it?
Yep, absolutely. Yep. So IPS has text and timing. IPA only has text. So we've gone for, I guess, the lowest common denominator and just gone text. Yeah.
And core's got 3. Yeah.
Yep. Yep. Okay. One more thing I just wanted to mention was that we do have an EOI out for Spark testing. So this would be a great opportunity to come along to test AU core, patient summary, and e-requesting. All of those IGs will be available in mid-2025 in draft. And essentially run some targeted test events to demonstrate if we're to determine really if we're on the right path for the IGs and if there's anything else that we need to add in before we get into the ballot phase, because around August we go into the ballot phase, so we want to make sure that we've got all of the requirements in before then. So there's a QR code on your screen which you can fill in to indicate which dates might work and what you'd be interested in testing. And I guess that's the end of the info session, unless there's any more questions. Just check the chat. I can see the chat now. Okay, doke. Well, thanks everyone for coming. I hope that was informative on the different elements of dosage. If you're interested, I could do another one on timing and do a deep dive into that, and maybe we could explore some of those crazy use cases and map them out and see how we can get them described. I'd be willing to do that. So yeah, just let us know, and yeah, we'll leave it there.
Thank you.
Thanks very much.
Thank you.
No worries.
Well done. Thank you.
Thanks.
Thank you.
Now I just need to figure out how to stop the recording.